need for outpatient transformation was primarily around the fact that outpatients within the NHS hasn't really changed in 100 years. It's the same model as it was, before the NHS was even set up.
Cornwall has a long history of IT in healthcare. Different systems have grown up over time, really driven by enthusiastic and passionate people around meeting the needs of particular services, but as a result it means those systems are not well joined up, and that's the thing that's really coming across from my clinicians. All those old systems make it really hard to share data. So the strategy really is about introducing capabilities to share across clinicians, but really importantly to start to open the opportunity to share that information with patients and give them the opportunity to manage their health themselves.
So what we did towards the end of 2019 is sign off effectively a new operational model. So that involved a single point of entry for all referrals. So when we mapped it out, all of the referrals, there was loads of different ways into our organisation. So all referrals go into this one bucket and are all vetted and triaged to the most appropriate event, but also to the most appropriate provider. We were quite ambitious in terms of not wanting to do it just for the trust, but also to maximise the capacity of the independent sector providers across the system.
We have deployed technology to manage our referrals better and more efficiently, and being able to signpost them into different services for face-to-face, remote consultation, including telephone and video, and management through advice and guidance.
We knew the technology platforms that we were going to use. Again, I think that's a part of the strategy response now, is thinking about platforms that are actually supporting us in the longer term and that they integrate with other solutions. So that's probably the key change. Is in the past we would have set up a different web portal per application. But with this, we're communicating through the portal for all of our outpatient work. And of course, in the future, we need to do more in terms of the ICS integrated care system as a whole. So it's about a small number of platforms which actually work well together.
Before the implementation of Patient Hub, my day was a lot more paper-based. So the only way that we could tell patients about their appointments is by sending them letters in the post. It's amazing now to have something that automatically is sending text messages, emails. Now with Patient Hub, they've got all that information right there, online, whenever they need to check it. It means that we're going to not have so many missed appointments at the end of the day. We want patients to attend those appointments. That's a big part of my job, is making sure that clinic spaces aren't empty, that people get seen as quickly as possible.
So the role of Netcall, obviously, in terms of our patient portal, we'd been using the telephony platform, and so the opportunity there for me was around viewing different channels as complementary to each other. So by using the portal, it's a complementary channel to voice, and of course digital channels fundamentally are the things that are changing in the world as a whole, and we want to be a part of that in Cornwall.
So building on the benefits of the fact that patients are able to engage with their appointment slot, we are seeing that patients who are able to adjust their appointment time, agree their appointment through the app, the DNA rate do not attends for those patients is half the trust's average. So it's a real significant gain for us. The more we're engaging with our patients through this technology, the less we're seeing appointment slots wasted.
Working with Netcall's been great because they've listened to our ideas, they've understood and got the vision, what we were trying to achieve in terms of an end goal. So in terms of our model, it's now included in, as an example, in planning guidance to support other systems looking for case studies to implement their own personalised outpatient programme, which is a key component of elective recovery across the NHS this year.
So I think that the data is definitely indicating to us that we are putting the patient at the centre of what we're doing, enabling them new ways of controlling how they access our healthcare. And the fact that doing that is seeing the do not attends reduce is real testimony to me that the more we use technology to reach our patients, the more that they can access our healthcare.